I'm Mehak and we are at ATTD 2024 Florence. I am with team Digimed and we have today with ourselves Dr. Amit Dey from India, and we are going to share our experiences of ATTD and what are our learnings. So starting with the question that I have for Dr. Amit. Dr. Amit, so we attended a conference on using CGM in hospital settings. So first question for you is, how accurate CGM can be in critical and non-critical patients in hospital settings?
First of all, thank you, Mehak, and it's wonderful to be here in Florence, attending the ATTD 2024 conference. To all our viewers out there, this is one of the most dedicated conference on diabetes technology happening, with all the insights and the latest updates coming from across the globe. There are so many delegates joined from different parts of the world, sharing their experience and research here. So coming back to the question that you just asked, there is a lot of research which is going on about the potential use of continuous glucose monitoring in hospital settings, both in the critical and the non-critical settings. And there are a few introspects happening about the efficiency about the CGM data, because if you talk about the critical care settings, you would have patients having hypothermia, patients having hypoperfusion, low blood pressure, patient would be there in sepsis or in some kind of hyperglycemic emergency state. So a lot of research is at the moment going on how effective continuous glucose monitoring could be compared to that with the standards of care. But it's definitely under research and it looks very prospective in terms of the outcomes that the research has shown. And this is something that was presented today by Dr. Bruce in one of his lectures about how these researches are happening, and more data and research is coming up on this.
Yeah, thank you so much for sharing that. And like we heard from Dr. Bruce that it is not FDA approved, but still, just to think more about it or understand more about it, what impact does using CGM in hospitals have on patient outcomes, safety and satisfaction?
So two most important thing we feel that continuous glucose monitoring used in hospital settings would do. One is, of course, reduced incidences of hypoglycemia, as well as reduced incidences of any major hyperglycemic peaks, which is very common in hospitalized patients because of stress hyperglycemia, especially in the ICU setting. So the studies which Dr. Bruce presented today, and also some of the studies which are available on the literature, we find that yes, use of CGM in hospital setting does improve the outcomes in terms of hypoglycemic episodes as well as hyperglycemic spikes over and above the standards of care. So it does look very promising, yes.
And is CGM cost effective for hospital use, and what are the main challenges for its adoption?
So that's a very interesting question. In fact, the whole session was revolving around its cost effectivity and the need to use it. So I think that's going to be widely varying from different country to country. If it's driven by insurance, then probably it would have a different context. In a setting like India, where we all know that continuous glucose monitoring devices are still costly for a major section of our population, we really need to prove the efficacy of the process to kind of justify the cost factor that goes in.
Right.
But having said that, technology is the future in the field of diabetes, and there's no reason why we should not explore adapting continuous glucose monitoring in hospital settings. A lot of research is on. It's still a lot of research is on in terms since 2019. A lot of papers have been published, a lot of RCTs have been conducted, and the last 2 years a lot of trials are going on, and probably very soon we will be finding an FDA approval or some kind of guideline recommendation of using CGM in hospital settings as well.
Yeah, wonderful. Thank you for sharing that, and thank you Team Digimed for taking this session with us. Thank you so much.